Hello everyone, hope you all are having a lovely Sunday today. So with our live demo again for the class for Composite today, thanks for all your patience. We started a tiny bit late today as expected. Let me know if you all can hear me correctly and clear, and then we can all start. So if you like to just comment and let me know if you all can hear me correctly and clearly, and then we can all start. All right, thank you, Tina. Manu, Swat. All right, so you all can hear me. That's very good. So we'll be beginning again. As I mentioned again in the Facebook page, that I won't be showing a full demo today, but we'll be sharing all the tips and tricks today for the class 4 composite, and I'm very sure that's going to help everyone understand some of their mistakes a bit better. All right. So beginning with the first thing, which is very crucial. Again, I always tell everyone, I always talk about majority of the time when I'm posting something is to be related with the Australian Dental Council exam, what you do in the exam. So do not get into the social media trap when you see such amazing work from different clinicians posting their work, and we say, oh, that's amazing and that's pretty good and that's amazing. I know, but that's good for the clinical side. As soon as you come to the theoretical side of things, with the examination point of view, a lot of things don't work very well. So that's why I'll always suggest that do not fall into the social media trap. Whatever pics you see on Instagram and Facebook and all, it's good work, but it may not work very well for you for the exam. So be mindful that we want to focus completely on the ADC exam and completely on the grading criteria that has been given to you already. So make sure do not fall into the trap and focus just on the grading criteria. So at the end of the day, if you fit really good in the grading criteria, but if your task does not look that 100% great, does not matter. You just need to stay well clear within the criteria and pass the exam. And that's our main objective of all the demos we teach as well. Just for you to understand is that for the task to look amazing and to pass in the exam are two completely different things. Majority of the students who are passing may not have a very amazing hand skill or a handwork, but they still yet pass the exam, because if you see the grading criteria and understand it well, it's not necessarily required to produce an amazing work. Okay, so first thing, very important, I'm just going to close the blinds, make sure it's a bit better for everyone. So number one, which is the most important thing, is to understand the grading criteria. Make sure you read it as many times as possible. I think it just got a bit darker now. It's a bit better before. A bit more down. So with my technique, what I follow normally is, and I've shared it on YouTube and my Facebook page as well, you can always watch it again if you have any confusion, is what I personally feel with this class 4 composite, the only tricky bit is to create the palatal shell. Once you have created the palatal shell, it just becomes a lot more easier. Your whole class 4 becomes easy. And creating that sort of like the labial surface is a lot easier. It's not difficult at all. Okay, if you know how to do it correctly. So the first thing, make sure do not fall into the social media trap. Do not worry about how good it looks. You just have to stay well clear within the criteria. Number two is make sure you are well aware of the grading criteria. When I say you're well aware of the grading criteria, I mean that you exactly know when are you in borderline, when are you in satisfactory, and when are you in ideal. And most importantly, when do you end up in unsatisfactory? You need to know exactly, looking at your task, that, okay, this way, something's gone wrong. Or I'm in borderline, or I'm unsatisfactory or something. Okay, anytime if I'm not very clear and if you guys can't hear me, please send me, like, type a message and I'll just refresh the whole thing again. So don't need to worry about that. Okay, normally in the ADC, you get a very clean cavity like that. Okay, you should get a very, very clean cavity. So you don't have to worry about, a lot of people are really worried about that, maybe my cavity is not that clean and stuff. No, you get a very, very clean cavity. What I always do suggest, that try to practice with a bigger cavity and make sure this side is more towards the gingival, or even equigingival. Just practice at the hardest level. So even in the exam, you get like a very sort of like small cavity. It would be easier for you to attempt it. But if you have always practiced with a small cavity like that, in the exam it becomes like a big cavity, then it might be a bit difficult for you. So always practice at the hardest sort of like positions and hardest cavity markings that you can make. And so in the exam, even if it becomes like a big or difficult situation, even equigingival, you can always create that. So you have to practice it many times. Okay, so to begin with, a lot of people, as I've mentioned in my video as well, to create the palatal shell, they do something like this. Let's see if I can, it's a bit hard to. They do something like this. Now, it's not wrong, but in my opinion, you can do it a bit better. So what I normally suggest is, let me zoom out a bit so you can see better what I'm doing. So what I do is I come from one side here, take this band all the way, turn it like that. So now this way, I feel it's a bit more secure, sort of like the mylar strap. So even if I'm holding it correctly, or if I want to make it a few turns, they just holds it in place. I don't really have to make sure my one finger is all the time there. Even if I move it side, but it's going to move the whole thing. So this is some of the techniques. If you guys feel free to take a screenshot of this thing if you want to. This is something I prefer, to put a band like that. Now, what I need you all to understand is, if you are trying to create the distal, which is missing, so your mylar strip will come from the opposite side, from the mesial. And if I'm trying to create the mesial, then the mylar strip, this engagement will be on the vice versa on the other side that you will do. Okay, so if it's mesial, then I will hang it to the distal side and I will convert that completely, vice versa. Okay, now when I talk about this thing to create the palatal shell, you can either do it with flowable composite or do it with packable composite. Both are right. Again, in this exam, you will see that nothing is right or wrong. It's all about your hand control and whatever you feel more comfortable in doing. So if a lot of people tell me that I'm comfortable in doing flowable, there's nothing wrong with it, use flowable. However, some people say that I want to use packable and I feel my hand control is a lot more stable with that. There is nothing wrong with that. You can use packable as well, no problem at all. But what we need to understand is with the palatal shell, you need to make sure your finger positioning matters a lot. And then how you see is in the mirror there. So what we really need to try and create is a bit of a smiley. So let me zoom in a bit on the mirror there so you all can see it a bit better. Let me just, this camera keeps moving. Recently, I've realized that the online demos are a lot more harder to achieve than one-on-one demos, because it's the camera setting is so hard to do that half of the time I'm more worried about if the person can see it rather than the content what I'm trying to deliver. So it just becomes really hard, especially with different angulations. If you just want to show you the facial or buccal or labial surface, no problem, but as soon as you want to show different angles, it becomes really hard. So what we really need to understand, I think it's shades coming from the light. Let me just take it out and show you in a different way. I think that's the most ideal way of showing. Okay, so what we need to really understand is we need to create sort of like a smiley there. Now what I do is once I've got this hanging like that, I will check with my mouth mirror, and then what I want to see is this smiley is nicely created. And then once you feel it's nicely created, you have that good. With the help of a ball burnisher, just go on the side and just try to create that marginal ridge there. And then again, the sort of like the pressure you will use, it would be say about just a feather motion. So you're not trying to give any force or anything there. What you're trying to do is just with a gentle feather motion, trying to create that sort of like ridge. So by the time you cure it, it should be nice and ready. Now, if you all can appreciate the lingual sort of like anatomy with the help of a malar strip, has already given me a beautiful sort of like smiley there. And if you try to appreciate the central size on this, that's exactly what we've tried to follow. So nice smiley, and there's a tiny bit bulge here for the ridge, and that's how the anatomy should be. Now, if you do this step correctly, the entire thing becomes really easy for you. So you have to practice that as many times as you can, but make sure that do this step correctly. Once this step is done correctly, the entire things become easy, and then your lingual is done in one step, one go. And after that, what you really have to do is just fill that all up and just try to finish it off with soft flex. Now, a lot of people, what they do when they don't do this step correctly, they spend half an hour, 40 minutes, even 25 minutes, depending on your skill level, try to create that palatal shell and try to finish it off with enhance and stuff. And then you never get it right till the end. So once you practice this motion, everything become easy. Now let me start moving my finger. So as soon as I move my finger, this bends a bit. Can you see that now the depression has closed a bit? This has gone in. This is something what you can do, the worst thing you can do for your class 4 composite. So make sure your finger should be at the restoration and the tooth junction. So the future restoration that you're going to put in there, like the palatal shell, and the restoration, it should be say about 70% on the tooth and 30% on that, and not much firm pressure. So if as soon as you put a firm pressure, this is going to go in, and now when you cure it, you will see that this is going to become like a depression. So very important, look at my finger again, tiny bit of pressure, that's all you need. Don't try to press too hard like this. Okay, hope it's clear. Make sure when you press it, touch bit of press, and then you can move your finger a bit on the mesial or a bit on the distal, just to see where that tooth restoration junction is getting closed up nicely, and where exactly are you getting that sort of like the smiley that you need. And once you get that correctly, everything else become. So just focus on the adjacent tooth. Always look at the adjacent tooth. It will give you like a nice idea about what you're making. Okay. So what we need to focus, two things, two important tips here. Do not press too firmly that it closes up. And make sure you move to the mesial, move to the distal with your finger, and see where you're getting the nice smiley made. As soon as you feel it's ready, that is the time you go with the ball burnisher, get this motion like this, feather motion again, not too much pressure. Even if you feel you have a perfect sort of like smiley, still trust me with my experience, give that ball burnisher, it creates a big difference. And once you feel that you are ready, that's the only time you go ahead. Now a lot of people say that, okay, I'm only creating the palatal, why put the wedge on? Because I always advise to put a wedge in this step. Now I do understand you're only creating the palatal, but if you are using the flowable composite, majority of the time it does goes down from the gingival embrasure. And now what happens in the exam? You created that, beautifully done, but you have a bit of an excess hair. So now what happens is you're going to spend an extra 15-20 minutes removing that excess, and still you won't be able to remove it. Because again, we need to understand the ADC is tricking us in this way, because they're not providing us any finishing burst. You don't have a yellow burr available. You only have soft licks. And again, with the help of soft licks, it's very hard. It's very, very hard to go in that small space there to clean it up. Because as soon as you try to clean it up there, majority of the time you end up damaging the gum. So what I try to explain to everyone is, do the first step, take your time, practice as many times, but do it the right way. If you try to do it in the wrong way, it's going to waste an extra 15-20 minutes correcting it. So if I do a flowable composite technique, even with the help of wedge, ideally, if I've put the wedge in nicely like that, okay, you can appreciate now it has closed the gingival embrasure. And now I do the smiley that I was talking about, move my finger, and then try to do it with the ball burnisher, try to create that smiley again. And if you feel that it's ready and you do it with the flowable, and again, if it goes, what I normally do is I break the whole thing and start from zero. Because the only problem is correcting it later is going to cost you more and more time. So what I normally suggest is make sure you do the step right, put the wedge in, and if you like to use flowable, by all means use flowable, but make sure you can sort of like control it really well. Now there's two things in there. Now if you see, by creating that smiley, it's just sort of like unintentional, but my thumb is pressing as well, and it's causing a depression on the buccal. Now, what we need to understand is even if it creates sort of like a depression on the buccal, it does not really matter because I'm only trying to create the palatal shell first. So if a depression comes on the buccal, you don't necessarily need to worry about that. You only look at the palatal, don't worry about the buccal. So if you get a depression like that on the buccal and your thumb presses, don't need to worry. Just make sure your lingual is nice there. Okay, and what I normally do after this is I put a bit of a flowable in there and then you cure it. Make sure it's nicely formed there. Now, a lot of people say, okay, I don't want to use packable. You can use packable if you can control it. No worry, you can use packable and then cure it. So the first step, what we're doing is we're creating the palatal. And then what we do is with the either with the flowable, either with the packable, you cure the whole thing like that. Now, there are some people who they say that our contact is always loose and never come correctly. For those people, what I can suggest is do not do it in 2 steps. You do it in, say, about 3 steps, your class 4. So what you do is after you've created the palatal shell, okay, second step is you hold your mylar strip correctly. Now because you've already created the palatal shell at that step, you don't necessarily need to worry about holding this finger very firmly. Just make sure you're supporting the mylar strip, but you don't have to press it really tight. And then second step, you only focus on the contact there. Okay, so second step, again, you don't have to fill completely to create the whole thing. Just try to create the contact and then cure it, and then check, double check, remove the wedge, check with the floss, make sure you have a nice contact. Once you have a nice contact and you're satisfied, then you try to fill the buccal. If you say that the problem is that my contact is still not clear, break the whole thing, start all over again. In my experience, what I have seen that recreating the whole thing takes and wastes so much more time than just doing a fresh one. So what I normally do is create the palatal shell. If I feel I'm not satisfied, I'll break it, and then I'm just gonna put a new flowable and then cure it again. It takes literally 15 seconds or maximum 1 minute, even if you're not very experienced. But rather than doing the wrong way and spending another 20 minutes correcting it. So step 1, you make the palatal shell, make sure you have a nice smiley there, make sure you're not pressing too hard that it becomes like a depression after you cure it, and make sure your finger is moving in the right position. As soon as I'm taking it more sort of like mesial in this tooth, you would say, and you would start to see that my finger, as soon as you go more mesial, the smiley disappears. But as soon as I bring it a bit more distal, it just starts to create an ideal depression there. The smiley becomes more sort of like enhanced there. And that's what we are trying to aim. Okay, so step 1, you do the lingual. Step 2, you do the whole thing. If you're comfortable, if you're not, what I would suggest is do it in 3 stages. Just make the contact. Second step, you just focus on the contact there. Okay, and then cure it. And the last stage is you just make a buccal and then cure the whole thing and focus on the buccal. Doing in a step-by-step method is a bit more sort of like helpful for people who have problems. I know people who do the whole composite in one go. They do the whole composite in one go and they try to recreate the palatal. If you're comfortable doing that way, you can do that way as well. But again, what I've seen is it just wastes a lot more time finishing, polishing, and especially when you don't have a lot of good finishing and polishing burrs available. You only have soft licks. Soft licks is very big. It doesn't go in the soft corners or small corners, and especially in the gingival areas. And that becomes another issue. So 3-step, try to use the 3-step. And hopefully that will help you all. Okay, in my opinion, class 4s are all about how you hold the mylar strip. If you can follow this contour like the way I'm holding it now with a smiley, trust me, your class fours are going to become very, very easy. And by the time you finish, you already would be like a lot more comfortable in doing your class four composites. Okay. Now, I would say if someone says I'm not comfortable using Packable, you can use Flowable. If someone says I'm not comfortable using Packable, you can use Flowable, or vice versa. But my only suggestion is, for palatal, Flowable is good. But for buckle, especially for labial, I would suggest put a thick one of Packable and cure it. The reason why I suggest this, that in my experience, the finish for the Packable composite is a lot more superior compared to the Flowable composite. Because in Flowable composite, you would start to see a lot more voids, lot more air bubbles. But when you see with Packable composite, you get a higher finish, you get a higher polish, and there are very less voids and air bubbles. But at the end of the day, if someone says, no, I really want to use Flowable, by all means use it. For my technique, I use both Flowable and Packable. You can do it in both. But what I would give you a tip, if you want to use the Flowable composite, that before you cure it, put the probe in, like the sickle probe, just run it in like that. What that will help you is that's going to remove any possible air bubbles. And when you cure it, you will hardly get any air bubbles. Because with Flowable composite, no matter what technique you follow, the tip always stays in. You majority of the time still get air bubbles. So the best thing to do is run your probe in once, then cure it. Hopefully you will not. But in my opinion, what I do is Flowable composite for the palatal, then do the whole thing with Packable. If you say that your contact's never really good, you do the lingual, then you do the proximal, even with Flowable or Packable, doesn't matter. And then the buccal or the labial, I would suggest put a big Packable chunk and then cure it like that. By the time you finish polish, trust me, you get a lot better and superior sort of like finish to it, and you get a nice shine to it that you hardly get with the Flowable composite. Now, the other thing is, a lot of people ask me is which soft flex to use. So for finishing and polishing, what I suggest is, if you're not very skilled and you're just starting with your sort of like composites, try to do it with the dark orange or light orange. Do not try to go with the red. Do not try to go with this one. The only problem with the red is it is very sort of like aggressive. It may remove the whole chunk of your composite out. So what you really need to understand is, do whatever technique to follow. You can use whatever technique that suits you. That's all good, no problem at all. But whichever technique you follow, make sure you know exactly how to work on it and exactly what results going to give you. And if you feel that there's one technique that one person follows which is really good and works really well for them, but doesn't work for you, I would say do not keep following that technique. Just move on to the technique that helps you better. Okay. Another thing which is again very important is putting wedges. Now, there's a general rule that I teach everyone is, whenever you do your composite, you do a single wedge. Okay. Whenever you finish your polish, you do double wedge. So whenever you are finishing your composite, you do a final polish, you have to put a second wedge there. I want the tooth to completely separate a bit. If you do not do it, again, there is nothing wrong with it, but majority of the time, by the time you finish and polish, you either end up damaging your adjacent in tooth, or what happens, the second thing is, you may end up removing your contact. And after finish and polish, as soon as you remove the wedge, now what happens, there's no contact there. So always remember that you have to follow two techniques. One is with single wedge when you're doing your composite. Once you're done with your restoration, second thing what you have to do is put a double wedge for polishing. If I'm doing the mesial side, I'm going to do it there. And then soft flex, start with dark orange, go to light orange, and then go to yellow. Again, yellow doesn't remove anything. Yellow only and only polishes it. It does not remove anything. So you have to understand that is another point as well. A lot of people say that, I've tried to do it with the yellow and it doesn't work because yellow is only polisher. It does not remove anything. Okay. Second thing, whenever you do an amalgam or a composite, make sure you create sort of like retentive grooves inside. So for a composite, I would say at least 1 millimeter retentive grooves to do your composite, because nobody checks it what's happening inside. They're only worried about what the final product is. And with these composites, because they can chip off sometimes, so make sure you have a nice retention in there. If you're using amalgam, then I would say that at least have 2 millimeter sort of like grooves there, retentive grooves, or something like a box inside. But for composites, I would say just 1 millimeter is fine, but at least have something there, which is quite important. Okay. Other thing is, if you feel that now you have excess hair and you have tried everything, you cannot remove it, the only thing you can use is only thing you can pretty much use is this strip, polishing strip. Okay, now with the polishing strip, let me zoom out again. There are two sides. One is a quite aggressive side, one is more of a polisher. Okay, so whenever you use this, make sure again wedge it nicely and never start with the sort of like the heavy side. Always start with the smaller side. And what you need to do is never do it like this. This is the wrong thing you can do, because you're gonna, yes, remove the contact, but you will end up damaging the palatal surface as well, which you don't need. You just need to remove the excess. So there's something that was taught by someone, was the S-shape motion. This is an S shape. If you see, it creates sort of like an S. So what you have to do is do it this way. What happens in this way, if you see, the benefit of doing this technique is it's not damaging or doing anything to the palatal side at all. And we just doing something to the proximal, and I'm not even touching my labial as well. So these are some of the benefits of doing sort of like the S motion. Now, what a lot of people do is go in and keep doing this and this. I completely say it's wrong, or I do not completely agree with this motion. What I normally suggest is just do one clean motion. So if you want to do this motion, just go in and say, that's it. So if you didn't see it clearly, let me show you that again. Until and unless it's like a big chunk that you have created, what I would suggest is just do like a clean cut, like S, and then that's it. One clean stroke cleans up everything. And if you feel there's a big chunk there, then what you can do is do the sort of like the aggressive side first, that follows with that sort of like the polishing side of the strip. But that's a lot better way of going through it, rather than you keep on dragging in it, doing and removing the whole thing, and then you end up damaging the tooth as well. So again, two ways of doing this is either if you feel it's very tiny, you just go with the polishing side and just do a clean stroke like that. If you feel it's really big, then I would say is, again, we're doing one clean stroke, but making sure that you do the aggressive side first, followed it by the other side. And then that should help you remove that gingival embrasure. Another very important point here is whenever you try to create your anatomy, and again, that was the first thing that when I started this, that do not worry too much about the social media trap that you see people's work and how amazing and good it's looking. When trying to create a good sort of like roundish appearance on the distal, especially with the lateral incisor, what happens is the contact is like a point contact. To create that beautiful looking incisor, you end up losing the contact. Now what happens there, that you have a beautiful composite filling, which is amazing in all aspects, but it is a straight fail in my opinion because there's no contact in there. So again, you start with your grading criteria. Once you have satisfied all your grading criteria, only then you start to understand how your tooth is looking. And that is the best way of passing the exam. As I again say, you're just focusing on passing the exam. Do not focus on how your tooth looks initially. Once you feel that you're finished and your contact's there, but your round turn maybe is not looking that great for the distal edge, distal cusp, do not worry too much about that. Nobody can fail you on having a less roundish cusp, but they will 100% fail you on your contact. So to finish it off, and then you can ask me any questions if you have. Most importantly, for class 4 composite, it is the high aesthetic zone. So you need to understand you have a high polish, you have a high finish, tooth restoration junction. If you see the composite here, tooth restoration junction should be free flowing like that. Free flowing with your probe. It shouldn't stop at any point. If you feel that it stops and keeps going, it's borderline. But then if it completely stops, it's a straight fail. Again, the integrity of the restoration is not that great if your tooth restoration junction is not that clean. Okay, so high finish, high polish, tooth restoration junction should be clean. Most importantly, with any restoration, contact comes number one. Good, clean contact. So when you run the floss, you should hear like a tuck, a nice tuck. If you don't hear that, either it's a bit loose contact, and again, you can fail on loose contact as well. So if it's a very tight contact that you're literally just holding the whole body pressure, and then again the floss is going in with that much pressure, it's a very tight contact that can fail you as well. If it's such a loose contact that you can just flow in and it's no sort of like pressure going in with the contact, again it's a fail. You have to make sure you have a clean contact. And again, when I say it's a fail or not, it's just putting yourself at risk. Because in my opinion, if I'm the examiner, I may say that, yes, it's not too bad. I will give him at least borderline. But maybe there's a different examiner and he says that, no, this is a clean fail. The contact is not good. So you cannot challenge them, right? So that is why it's very important to stay in the safe criteria and to make sure the contact is clean at all times rather than risking it and stuff. Now, if you have the mylar strip in good place there, your contact should be good, and wedge is there, contact should be good, and contact is directly proportional to axis. If your mylar strip was good, your wedge placement was good, and your contact is good, you have a nice motion flowing and you will never get an excess there. But if your contact is rough, there's a higher chance you get some excess and roughness as well. So now what we need to understand is excess more than 0.5 millimeters, that's also a fail. Roughness more than 0.5 millimeters is also a fail. Again, when you do complex composites on a premolar, the concepts just changes slightly, not too much, because it's not a high aesthetic zone. But when we're talking about high aesthetic zone, we need to worry completely on aesthetics as well. So make sure good contact, no excess, no overhang, tooth restoration junction clean. Same on the buccal and on the palatal as well. It should be free flowing. It's not touching. Anywhere your probe stops, you remove it with Softlex. Okay. When shaping it, make sure shape it to a level that you're not losing your contact. At the end, if you feel you're not getting a nice turn, if you do any more, you will lose your contact. Make sure you stop there. Make sure you stop there and do not do that, making it look great. Okay? And if you follow these things, overall your composite should work very well. Last thing, for finishing, polishing anything, as I said, always try to double wedge. Another thing which you should do every time is whenever you polish your composite, always do it with water. So either with enhance, either with soft flex. I know with the enhance, the manufacturer in the book, it says that do not use water. But again, I'm not talking about the clinical scenario. Okay, I'm talking about the exam protocol you should do to pass the exam. Again and again, try to understand that. So for enhance, what we really need to do is use water, and for soft flex or any polishing, and if you want to do it a bit with the burr, always do it with water, because what happens as soon as you not use water, the uncured resin come out, and then you have those white line in your composite that will never go away. So work on these things and see if that actually helps with the tips and tricks for today's session. So I will just finish my session here. I hope that was helpful. Now, if anybody has any questions, feel free to type in a comment and let's discuss that for another 5 minutes, and then we will finish today's session. All right, so the direction to polish the soft flex. I always do it from restoration to the tooth surface. Now again, a lot of people, you may say, they may tell you again and again that always go from tooth to restoration, but what I have felt that you always go from restoration to the tooth. Again, I'm not telling you to go from here, but I'm just saying from the junction, if this is the composite, we're trying to polish this thing, for example, let's say, zoom out a bit, let's change it there. So if this is, imagine I will just polish like this. So just not here like this for the whole thing, but just at the end like this. That's the way I try to polish it. And again, try to have a 35-degree angle, not a complete 45, not a complete flat, not complete vertical, a bit 35, a bit less than 45, and that just works pretty well. Okay, secondly, where is the next one? If the contact is light on the exam, how can we correct it? So that's Irina's questions. Irina, now that's a bit tricky to do, but it's not impossible. So you can always create a contact. Whenever I do a demo, I always advise people to, and I show them how to recreate the contact. So what you do is you hold this, you put a bit of flowable on the corners, and you hold it and you cure it. And again, I know it sounds very technical, but it is very technical. I think I will make a video on YouTube when I get time to show it correctly, because that technique is a bit sort of like technique sensitive, but it works pretty well. So Rina, don't worry. Hopefully we can make a small video and explain that properly to you. To what extent do we prepare the proximal wall? Again, for Man's question, Man, what I would suggest is try to do all different designs. So try this design as well. Try a bit less, sort of like going to the mesial, a smaller design, go to the up till equigingival. Try all different designs. So in the exam, whatever design comes, you are ready and comfortable doing it. So there's nothing wrong or right. Just, I would say, try pretty much everything, and that helps. How to shape marginal ridge at youth composite junction. It comes prominent or sharp sometime. Marginal ridge. Swati, I didn't understand your question. If you want to elaborate that a bit more for me, and we can reply to that. If it's a big cavity up to the gingiva, how do we place the wedge? Again, now this is the question. Again, it's a bit tricky, but as I said, it's not fairly impossible. If it's till the sort of like the margin there, you place the wedge not completely in. You do not put the wedge completely in, just put a slight bit there. So if you see my wedge not completely edge, it's just a tiny bit in. You create a bit of proximal wall from the bottom there. Once it's created, then you put the whole wedge in, and then so what we're doing is doing a bit of a margin elevation there first, and then creating the whole thing. Again, it's a bit tricky, but it's all about the practice, and then you can do it well. How to prevent excess on the buccal surface to don't Bunsel, it's impossible to do that with a strip. You will get somewhat excess until and unless you handly doing it. It's impossible to do on the buccal. So you will get some sort of excess on the buccal or the labial, but you will have to sort of like practice shaving it off with the soft flex a bit better. Can use Teflon tape on the opposite side. Now, Manu, this is the only thing I'm suggesting is do not practice on things that you might not get in the exam. So if you're 100% sure you get Teflon tape in the exam, do it. But if you're not sure, whatever you do in the clinic, try not to replicate that scenario, because again and again, I'm trying to explain it's a theoretical based clinical exam. A lot of things are not available in the exam that you do in the clinical scenario in the clinic. In the clinic, we have so many different burrs and polishers that we can do variety of the stuff. Exam, you don't get these kind of stuff. So it becomes a bit harder for you. In the exam, you use that wooden wedge. These are the only wedges you get in the exam. So you can only use one sort of, you don't get a variety of options in the wedge sizes. So you have to sort of like use and utilize the same wedge. Okay, no worries, Bansal, that's all good. How to finish the 0.1 millimeter exit restoration into ejection. So Man, you do it with the Soflex. Again, if you feel this excess is very tiny, less than 0.5, you do not use the red, you do not use the dark orange, you only use the light orange, and slowly, gently remove it, double check, triple check, dry it, check again, and then slowly 2-3 strokes, dry it, double check, triple check, and keep going like that. What the best way to prevent any excess of resin? Again, as I said, it's really hard to prevent excess. On the palatal, it's very easy if you have the mylar strip in place correctly. The proximal surfaces, again, if your wedge is good, your proximal strip is good, you shouldn't be having problems there. But buccal and labial, because the way we do a bulk and do the positioning of the strip, it just becomes a bit hard. So it follows the principles. You have to remove a bit and shape it with soft flex, and that's the protocol that everyone pretty much follows. So I think that's pretty much it. Any other questions? I'm happy to answer another 2 minutes, and then we will finish the session. I hope this session has been helpful for everyone. Again, after like a couple of times trying it, if you still have any further questions and you are a bit confused, no need to worry. You can either send me a message on Instagram or send me a message on the Facebook page on ADC Help with Dr. Mac. The details or the link of the page is in my Instagram bio. You can go press on it. It'll take you to the Facebook page. There are a couple of useful videos. I've started to post all the videos on YouTube as well for people who don't have access to Instagram and something else, Facebook and stuff, or Instagram. So YouTube, all the videos are available. Hopefully we'll try to save this video and post that on YouTube as well for people who couldn't watch it. So I think there's no more questions. My pleasure as always. Hope you all stay safe. And So we have one more question. How do you create incisal angle well shaped? Comes very sharp. So again, for creating the incisal, what you have to do is you have to keep in mind the secondary plane. So you never go straight, you turn this like this, you turn this like this, you turn this like this. So when you turn this like this, it already automatically becomes like a nice round. But if you try to do this and flat like this, it becomes sharp. So what you have to follow this motion like this motion, and then Himani, your problem should automatically solve. The tooth is also polished along without polishing part and loses the shine. Again, just polish it with Enhance, put a bit of Vaseline, polish it again. That should be good. Again, they don't ask you to have like a luster polish in the criteria. They ask you to have a reasonable polish, and that should be enough to let you pass your exam. Okay, so don't need to worry too much about making it look great. Okay, so don't worry about making it look great. Just follow the basic protocol. Stay well clear within the criteria. You should be, don't have any major problems passing the exam. Again, do not go into the social media trap of making it look great, because by doing that, you will make it more on the failing criteria. So these are the things basic you follow. Stick with the basic, that should help. Okay, everyone, no more questions there. So hope you all have a lovely Sunday. Take care and stay safe, and we'll see you next time with another demo. Take care. Bye-bye.